Hi, it's Callum. So we're going to look quickly at the structure of the uterine wall. We're going to go into more detail about the endometrial histology in the next few videos, but this is just really to give you an overview of the structure. So the endometrium in this example is actually not entirely normal. It looks like this patient has had some sort of progesterone therapy of one kind or another, so we'll not get lost among the detail of that too much. But this is the endometrial cavity on this side. This is the endometrium, which has two layers. There is a basal layer, or the stratum basalis, which is at the bottom, and that is the layer that is constant. It doesn't tend to change very much during the ovulatory cycle, or the endometrial cycle, and doesn't get shed. It's constant. And then above that, towards the luminal side, is the functional layer, or the stratum functionalis, and that is the layer that will change during the cycle and will get shed off during the menstrual phase. Below that, so that's the endometrium. Below that is this, forming the vast majority of the wall thickness here, is this very pink, very thick layer, which may look familiar to you at this stage because we've looked at this substance a few times now, and it's because it's smooth muscle. So if we look at very high power here, we can see cigar-shaped nuclei, quite bright pink cytoplasm, arranged in fascicles of cells all running in the similar direction. That's what we would call it, like a fascicular architecture. They all run in parallel in fascicles, like a little bundle that's going that way. And then this is a bundle that's coming out towards us, and this is another bundle that's going longitudinally again. So it's got a fascicular architecture, and this is smooth muscle, a big thick band of smooth muscle. And in the endometrium, in the uterus, the wall of the uterus, we call that myometrium. So we've got endometrium, myometrium, and beyond that, we've got connective tissue. Now, depending on where you are within the uterus, it will either be part of the uterus which is serosa-lined, in which case you'll get a thin layer of mesothelium or serosa, peritoneum, which lines the serosal cavity, or it will be the part of the uterus which is connected to an adjacent structure, such as the bladder, in which case this will be connective tissue that's in continuity with the adjacent structure, and we call that parametrium, and that's just connective tissue. So endometrium, myometrium, parametrium, and that really is, I think that's all I wanted to say. I will point out one other thing. We're going to look at this cervix shortly, but before I do, I wanted to point out the stroma of the endometrium to contrast it. We'll contrast it later on. So these are endometrial glands with elongated nuclei, which don't have mucin in them, and they're surrounded by stroma, which is kind of haphazardly arranged, quite cellular stroma made of these cells with kind of round to ovoid or oval-shaped nuclei, which are quite tightly packed, which are quite blue-looking at low power because it's mostly nuclear material. So keep that in your mind, and we'll revisit that when we look at the cervix. But over the next few videos, I'm going to look at the various stages of the menstrual cycle endometrium. Okay, speak to you soon.